Kerry.
Ready to go? Well, thanks for coming, everyone. Can I say pleased to be here today, joined by the Health Minister, Brad Hazzard, Chief Public Health Officer, Dr. Kerry Chant, and the Head of and the Director of Public Health Pathology, Dominic. Obviously today we've seen an increase in case numbers across the state. What's incredibly pleasing is to see the strong capacity in our hospital system and our ICU system right across the state. And that is because of the strong vaccination rate right across New South Wales. Today I want to thank every single person across the state who has gone out and been vaccinated. That was our clear message over the course of the last 6 months. And to be in a position where we have 95% of people on first dose vaccination, getting very close to that level at a second dose is the best way to protect yourself, your friends and your family. So that success that everybody has had right across the state has ensured that we've been able to open up as quickly as possible, but as safely as possible, and ultimately keep people safe across the state. I'd like to make the point today, once again, in relation to booster shots. As we've seen from ATAGI, that booster shot period has moved from 5 months to 4 months. So if you received your second dose vaccination on the 28th of August, you are now eligible for a booster shot. And for many people, over the last 6 months, they would have received their vaccination through their GP. If your GP is unavailable over the Christmas break, you can receive that booster shot through one of our 40 vaccination hubs right across New South Wales. It's simply going to nsw.gov.au. The Health Minister and I were out recently at our Homebush vaccination hub. They were taking walk-ins, as in fact I walked in myself and received my booster shot on that day. So my clear message today to the people across New South Wales is, if you have not received your booster shot, please go out and do so if you are eligible. That's 4 months after your second dose vaccination. It's very clear from the evidence, particularly when we look at the hospitalisations in the ICU numbers, where we have 95% of our population vaccinated across the state. The overwhelming majority of people in ICU are unvaccinated. Vaccination protects you and your family. So please, if you haven't received your first dose, or if you received your first dose, please go and get your second dose vaccination so we can get that rate up to 95% and above. In addition to this, I'd like to particularly thank our health workers right across our state. We are very proud, and I'm very proud as Premier of New South Wales, of the great health workers, our nurses, doctors, allied health professionals who are on the front line every single day. And being out in Wagga Wagga yesterday, meeting many of the nurses and doctors and thanking them for the work that they do. Over the last 2 years, they've worked tirelessly to keep people safe. They're incredibly proud of the work that they do every single day. And on behalf of the people of New South Wales, can I thank you for the work that you've done over the last 2 years, and as we move through the challenges of this next period. I'd also like to speak briefly in relation to the PCR, and Dominic will also provide some further information in relation to the process. We apologise for any inconvenience with those long queues. I know there are substantial efforts that are being made. Rest assured, we are doing everything we can to put downward pressure on those queues right across the state. I spoke with the Prime Minister this morning, and obviously we'll be having National Cabinet tomorrow. Looking forward to a discussion in relation to changes to be made in relation to close contact definitions and isolation periods. I certainly believe it would be best if we had a national approach, and I certainly look forward to having those discussions as we move through the meeting tomorrow. I want to thank Anastasia Palaszczuk for the decision that she made today in relation to the removal of the requirement for a PCR test from 1 January. So to say to people, if you are travelling to Queensland from 1 January, there is no reason and no need, and you should not be in any of those queues for PCR testing. There are many people who are lining up in those queues who do not need to be there, and we are doing everything that we can to increase capacity and put downward pressure on those queues. But if you are not sick, if you do not have any symptoms, you are not unwell, or have not been advised by New South Wales Health to receive a PCR test, you should not be lining up for one. We still are hearing that there are many people who are receiving these tests who are lining up, and by doing that, you're taking the place of somebody who needs to receive one of those PCR tests. So, clear message today, the system will improve. Some of the changes that have been made from the Queensland Premier today will really help ease pressure on that system, but still, the number one thing we can do is follow the advice that we've received from health. If you are not unwell or you have not been advised by New South Wales Health to receive a PCR test, you should not be lining up for one. I'm now going to pass to the Health Minister, who'll provide a health update, then Dr. Chant will provide a public health update, and then Dominic will provide some information in relation to some of the challenges in respect of pathology, and then we'll take your questions.
Thanks, Premier. Look, clearly we're moving into another major stage of this pandemic, and we're seeing a lot more Omicron, as is being seen right across the world. We know that Omicron, on all the evidence internationally and now here in New South Wales and Australia, is certainly far more transmissible. So chances are you're going to get it. We'll all get it. And therefore we need to understand at what points we need to rely on our health system. The PCR tests are there for a reason. I'll ask Dr. Chant and Professor Dwyer to actually clarify aspects of that, in addition to what the Premier's already said. But if you really don't need a PCR test, if you just think you're part of the community that can go and get one for free, all you're doing is actually getting in the way of people who are really needing PCR tests. So there are some people who I think are genuinely worried, but they're well. The worried well should not be lining up for PCR tests. People who are travelling to Queensland should not be lining up for PCR tests. We need to actually take the pressure off our pathology laboratories. I want to thank, by the way, the teams at the laboratories. We've got about 40% of all of the work that's done across New South Wales is done by our public New South Wales pathology, and the other 60% at the moment is being done by private laboratories who've come in and worked with us extensively in the last couple of years. They have worked so hard, and they have obviously got a bit of a backlog at the moment because of a number of factors which Professor Dwyer will explain, but it's so important that we as individuals empower them not to have to do work they don't need to do. So certainly, as the Premier said, if you're going to Queensland, for example, if you're in a queue right now, get out of the queue. You don't need to be there. You certainly don't need to be it tomorrow or the next day. You spend more time, I think, going out and going online, getting some fast deliveries of some RAT tests if you want to be up there on 1 January, or do a bit of a shop around to the various pharmacies, Woolies, Coles, IGA, any of the major supermarkets. Obviously there are some challenges in supply, but they're all trying to get as much on board. The private sector, the private market are doing their bit to try and make those available. And as the Premier said, we're also making some big orders, trying to, as we've said a number of times now, look at a formalised process that will work both to recognise the market but also recognise the needs of some individuals in the community, and that should be coming online mid-January or so. Finally, I want to say this. We're still hearing that people are declining to get vaccinated. They know better. They're watching social media. Forget it. Just get off the social media, for heaven's sakes. Switch off your social media, switch on reality, and go and get a booster. What we do know is that vaccinations and the boosters will certainly keep you far safer, and you can mix it in, of course, with the other health requirements that we've all learnt. Social distancing, wearing a mask particularly. Mask really works. But just stop listening to social media and make sure you're not the one who's lying in our ICU on a ventilator, because you may be the one who dies. There have been people recently reported in the press from overseas, some very well-known people, who have actually been talking about the fact that they won't be vaccinated literally a month before, and then they're dead. That can happen to you. So get serious, folks. If you're not vaccinated, go and get vaccinated. I'll ask Dr. Chant to expand a little more on some of those issues, and then of course Professor Dwyer will fill us in on some of the amazing work that's being done by the public and private pathology, but also some of the challenges that we face at this point in the pandemic. Dr. Chant.
Thank you, Minister. So New South Wales recorded 11,201 new cases of COVID in the 24 hours. and we had 157,758 tests. What that number reflects is some testing that's been obviously occurring and reflects some tests that have been conducted over previous days. So the numbers will jump around a little bit over coming days as we reflect testing numbers that have been performed over the Christmas and Boxing Day period. But I think what it is showing is that we are continuing to see a rise in cases of Omicron. We're seeing doubling every 2 to 3 to 4 days. But each of us have a role to play in suppressing the spread of the virus. Some of the key things we can do is not be out and about when we've got symptoms. Instead, go and get a test. And some of the changes that have been put in place around making sure that we preserve that fast testing capability that our residents have come to appreciate in New South Wales is restored by making sure that some of our low utility testing is not undertaken, and that we allow people to use RAT testing to give them that reassurance, or for other settings. So we really want to focus our PCR testing on symptomatic individuals or people that have been clearly advised they need a test by public health. It is important that I'm aware that people are using RAT tests, and I appreciate them using RAT tests, and they're going to be an asset and a tool we use going forward. But it is important that you are linked into care if you have a positive RAT. Occasionally RAT tests will be false positives, and we wouldn't want you to think your symptoms were COVID related when they're actually something else that might need to be treated. That's one reason. And the other reason is there are therapies and medications and treatment, particularly if you fall into high risk groups. So if you're unvaccinated, you're pregnant, you've got chronic conditions, it really is important that you're linked into care so we can use some of those therapies, because using those therapies at the right time, and that's very early in your disease course, means that it will reduce your risk of hospitalisation and ICU. So I just encourage people, anyone who's got a positive RAT test should also go and get that PCR test and talk to their healthcare provider. As we move forward, our testing resources, whilst great through the labs, have actually been constrained by the fact that we've got more prevalent disease. And so when you have a higher positivity rate, it tells us two things. That we probably are not ascertaining, getting to all of the cases, so there's probably more disease in the community than the numbers reflect. But it also has impacts on our laboratory, and that's a good segue to Professor Dwyer, that can talk about how when we've got that higher positivity rate, it means some of the techniques the laboratories have used to increase that lab throughput are no longer able to be used, and that's decreased our overall capacity. So, Professor Dwyer?
Thanks very much, Dr. Chant. So, look, the issue here from the laboratory point of view is how do we best use the PCR test to maximise its impact. So really we want to use these tests for people that are sick, the people that need to come into hospital, people that are advised by the Ministry of Health or the Department of Health to get tested. So they're really the people that best benefit with these tests. The PCR tests are the most sensitive, so the best ones to use in people who are ill and likely to end up in hospital. There are issues around getting these tests done in a timely fashion. That's because you need high throughput machines to do them. You need people to collect the samples. We use a lot of collecting centres around the state. Those queues for getting testing are getting out of control from the point of view of the laboratories being able to do the tests quickly. And for sick people, you want to do the tests as quickly as possible so you can treat them. The other thing is too that the number of staff, of course, in the laboratories is finite. This is highly technical work. We can't just pull these off a shelf, if you like, and do them. So there is pressure on the laboratories. So we want to reserve the laboratories for those people that are most ill and most in need of a test. The rapid antigen tests are also useful, not quite as sensitive as a PCR, but the ideal sort of test to use for people that don't have symptoms or that are worried about visiting their elderly parents or grandparents, that sort of environment, gathering together for functions, that's a situation where the rapid antigen tests are likely to be of great benefit. So I'd be happy to answer questions. So, yeah, one of the issues is around increasing capacity by pooling or combining specimens in the lab. That sort of process has worked really well over the last year and a half or so. But now that the number of positive cases in the community is so high, the ability to do that pooling is limited because you have to go back and retest them if they're positive. So we've lost that advantage to maximise our capacity through pooling. But as the Omicron kind of curve flattens out or decreases, we'll be able to go back to doing that and to provide the capacity that we need.
Professor Dwyer, in the most simplest terms, can you explain what pooling actually is?
So what we mean by pooling is that, for example, if you have 20 tests that come into the lab, you can take, say, 4 or 6 of those or 2 of those and combine them and then do the PCR on that combined sample. So in other words, you can test 4 people at the same time. If that test is negative, then obviously all 4 samples in that pool are negative. If, however, it's positive, then you've got to go back and test each of those individual ones to see which one is a positive case and which one, of course, is a negative case. And it's that process of going back and having to retest positive pools, that takes a lot of time and it takes a lot of effort, and it chews up reagents and so on as well. So the ability to pool is limited by how common the disease is in the community. And at the moment, with this Omicron surge, the numbers are too high to do pooling in a cost-effective and rapid manner.
I mean, you talk a lot about
just before answer the question, I just want to back some of those comments in, and we accept the difficulties in the fact that as we move through the next phase of the pandemic, that what we've been saying over the last 2 years in terms of going out and getting tested, and that's what we've encouraged, and that has been incredibly successful. As we move through this next phase, the messaging is changing and the direction is changing because it needs to. And what we need to have happen is that those PCR tests are there and available for those people who are unwell or advised to by New South Wales Health. What Professor Dwyer has just explained is that as those case numbers increase, as we move through this phase, that becomes even more important, because those who are unwell and who need those tests back, the time it is taking will naturally be longer if there are people in those queues getting tested unnecessarily. So we accept that this is a change in messaging. It is a very different position to the position that we've had over the last 2 years, and obviously that will take time to adjust. So we'll continue to say it as we move through this phase, but if you are not feeling unwell or have not been advised by New South Wales Health to do so, there is no need to be lining up for a PCR test anywhere across the state.
Is this an admission, Premier, that we just simply can't keep up? Is that what you're saying?
This is, as we go through this next phase, I mean, there are many positive signs here, many positive signs. We've seen that Delta that Omicron in relation to early reports is 1/5 as severe as Delta. That's incredibly positive. But there will naturally be challenges and inconveniences as we move through each stage of this pandemic. So what has been crucial and key in our state has been the vaccination rate. We have one of the highest vaccination rates, not just in the country, but the world, and that's provided us protection. And it's pleasing to see that as those case numbers, certainly much, much higher than they were under Delta, but we're still seeing very stable ICU presentations. There is strong capacity in our health system, and that is only due to the fact that everyone across our state, or almost everyone across our state, has made that effort. But when the circumstances change, so does our response, so does the messaging of the government, and so does the direction. And naturally, as cases increase, people will want to feel that need to get tested. And over the last 2 years, that's been the approach, and it's been the right approach. But as we move through this next phase, it's very important. If you don't feel unwell, you don't need a PCR test.
You talk more about the balance and health of the economy.
Yep.
You have about spiraling testing times, cases are almost doubled. In fact, to backtrack on some of the restrictions we didn't know about.
We've always made the view. We've said this from the outset. As we've gone through this phase, every press conference the Health Minister and I are at, we will tailor our settings to the circumstances we find ourselves in. We have said, as we open up, the alternative was to simply remain closed. The success and our pact with the people of New South Wales has been get vaccinated, which everyone has done in record numbers, and now we're able to open up. Now, as we open up, case numbers were going to increase. Every press conference we said case numbers will increase. Now they're increasing. We need to learn to live alongside the virus, and we're doing just that. Now, in the meantime, there will be inconveniences as naturally as a society we adjust to these new settings, and that's okay. But we just need to do what we can to alleviate that pressure on testing. I think the changes that have been made today from other premiers will make a real difference. There are some other changes we're looking at as well from a New South Wales government end, and I also think in addition to the approach from the National Cabinet tomorrow will also alleviate some of that pressure. And I particularly had a discussion with the Prime Minister this morning in relation to the procurement of rapid antigen tests. So we here in New South Wales have put in an order, as I've said, of 20 million. Today we're putting in another order of an additional 30 million tests. So this will provide great support to our state as we move through the next phase, but we'll work very closely with the Commonwealth Government for a national approach in terms of distribution. And as we move through the next phase, it will become the norm. It will become the norm that we have rapid antigen tests at home, or we purchase them at the pharmacy, potentially from the GP. And what that means, if you're going into a high-risk setting, if you're visiting an elderly loved one, that you would take one of those tests. So that will be the new norm as we move through 2022.
On the testing pressure, Premier.
We've got about 100 people in hospital adding on every single day. What is the limit and capacity for hospitalisation for COVID?
Yeah. Well, we monitor that each and every single day. We would have seen at the height of Delta earlier this year, we had well over 200 people in ICU. We're currently sitting on 61, and we monitor that with our health teams every day, and we're very confident of the position that we are in. As the Chief Health Officer has said, that still means we need to be cautious over the summer break. That's why we put some of those changes in relation to this period up to January 27, encouraging people, if you're having events, to have those events outdoors rather than indoors. If we treat people with kindness and respect, if we look after each other during this period of time, we'll ensure there's capacity in the system. We'll always tailor those settings. If the evidence changes and information changes, our number one priority is to keep our people safe. We've done that incredibly well over the last 2 years. We've done that in terms of opening up the economy, and that success in our state has been based on the efforts that everyone has made to get vaccinated. And now the only next step, the next effort we need everybody to go out and do is get that booster shot. And as I've said, many GPs are away over the summer break simply because you got your vaccinations, your first or second dose vaccination at your GP. That does not mean you can't have your booster shot in one of our public vaccination centres. There's 40 of them across the state. So please, you can make those bookings online at nsw.gov.au, and we want to get everybody as vaccinated and boosted as quickly as possible.
Premier, 11,201 cases today, almost certainly higher than that because a lot of people haven't been able to get those tests.
Yep.
How much is that number an underrepresentation to what you're actually modelling?
Well, as the Chief Health Officer said, some of those numbers that we're including in today's new count go back because of the time it is taking now to return those tests. And that's why it's important as well. It's another reason why it's important that if you are not symptomatic, that you don't line up for a PCR test. But ultimately, we've always said success isn't about the case numbers. I know there's a lot of interest in the case numbers. Higher case numbers, yes, are occurring in our state, but what is most important, what we've been saying all along, the measures of success for us are our ICU and hospitalisations, and importantly, our strategy has been focused and continues to be focused on vaccinations and boosters. And there are many people right across the state, based on the change that ATAGI has made, who are now eligible for a booster shot. If you've made an appointment, if you haven't made an appointment yet, please do so. If you made an appointment and you want to come in quicker, you can get in many of our boosters, our vaccination hubs right across the state. You can walk in and have an appointment and get it done today.
Modelling, Premier.
divided? Does it not create a divided society? You said you can go out, have your New Year's Eve celebrations outside. What about people who are immunocompromised and they're seeing 11,000 cases reported today with Dr. Chant saying there's more out in the community? What do you say to those people? They just lock themselves inside?
Well, the alternative is, as we move through this next phase, is to go back into lockdown. That is not what we're doing in New South Wales. That is not the alternative that we are considering. We have said we'll tailor our response to the situation that comes. If evidence changes, we will have targeted restrictions in place. We've always said that. But ultimately, the key here, the key success, the key metric is the vaccination rate. And if we go and get those booster shots right across the state, then as we've said, we can open up as safely as possible. Now to the question, that doesn't mean that there's not going to be inconveniences and challenges as we go along. Undoubtedly there will be. That's just not unique to New South Wales. It's not unique to Australia. These are challenges that we're facing right around the world. We can't eliminate COVID. As the Health Minister has said, we need to learn to live alongside it. But in the short term, there's going to be some challenges. There's going to be some additional sacrifices we need to make. But ultimately, vaccination has been key, and that has been borne true in what we're seeing in our hospitals at the moment. That if you look at the Delta outbreak, if you saw lower case numbers, higher hospitalisations, higher ICUs, the best thing we can do to protect ourselves is to be vaccinated. And as we've seen with a 95% vaccination rate, and the majority of people, the numbers don't lie, the majority of people in our ICUs are unvaccinated, with a population in New South Wales of 95% being vaccinated. So if you haven't been vaccinated, look at the stats and go and protect yourself and your family and get vaccinated.
Given, Premier, that you've said the case numbers.
Reducing the isolation period for asymptomatic people,
Yep.
are we likely to see a change in that? And will that be a priority for you at National Cabinet tomorrow?
It certainly will be. I've already discussed this with the Prime Minister today. I think we've had a very constructive discussion around it. My preference would be that we have a national response. I understand, though, that other states are at a different part in time with this pandemic. So different states at the moment have different challenges, but I think as we've seen globally, it makes a lot of sense to revisit and look at that isolation period based on the evidence that's in front of us. I understand that health officers around the country are meeting today prior to National Cabinet. Obviously, I'll be speaking to our health teams this afternoon in relation to those recommendations. I've had very constructive discussions with the Prime Minister, but I believe that will be a common sense change which ensures that as we move through this phase, as case numbers increase, we reduce the isolation period, and that to me is really learning to live alongside the virus. So I'd be very supportive of those changes. Obviously, I'll be having those discussions with our health team this afternoon. I've seen some of the recommendations that have been put forward by the Commonwealth, and I support them.
Premier, given that...
Conversation with the Prime Minister.
Well, I'll be in discussions in relation to our health team in relation to that. Other countries who have made those changes, like the US, for example, and the recommendations that have been made by the CDC, the US is still in a very different situation to what Australia is in. So they've obviously had higher case numbers for a longer period of time. We will always look at the evidence that's in front of us. I know that Dr. Chant has had discussions with her counterparts. I've had discussions with the Prime Minister. I do think we can make some sensible changes in this place, and I look forward to those discussions tomorrow.
Prime Minister, your conversation with the Prime Minister, are you going to push for free rapid tests for everyone, or what's happening there?
Obviously, the federal government are very keen to move forward on rapid antigen tests as well, and we'll work very closely with them. I believe for this to work in the most effective way, it's best to have a coordinated approach. Obviously, with funding discussions as well, that will come into it. It makes sense, obviously, for the Commonwealth to be ensuring that those rapid antigen tests are based in areas where they have responsibilities, such as aged care and disability care. So what would be best, and I think the discussions we'll have tomorrow at National Cabinet, is that as states start to purchase rapid antigen tests, as the Commonwealth also do the same, that we have a coordinated approach. And I think it's also important to note that the distribution of those tests will be important. We need to work through those areas, and I think if we can do that in conjunction with the Commonwealth Government, we'll get better outcomes. But ultimately what you want is you want to see those rapid antigen tests being available to those who need them, and we want to help. Obviously, they'll still be purchased as more and more through the private sector come onto the market and becomes more the norm in society. We, from a state government's perspective, want to help facilitate and support that, and the best way of doing that is working with the Commonwealth Government.
What is those rat tests have been around for months and months. Shouldn't, again, state and federal governments have been ready for this moment and had these rat tests ready to go?
Well, we've already put a purchase order in of 20 million, and we made an additional 30 million today. I think as we've moved through this next phase, it's become very apparent as we're shifting away from PCR tests that this will be the best way forward in 2022. Now, in the meantime, there's no doubt that there's going to be inconveniences as we move through that phase, but I'm incredibly confident that we will be getting through this. There's been a number of difficulties over the last 2 years. Everyone has made extraordinary efforts, but New South Wales is perfectly placed to lead our nation out of this pandemic. The efforts that everyone has made in relation to vaccination has supported that approach, and as we move through, the challenges will change. This is one that we're working through now, and the feedback that we've seen and heard to date in relation to the provision of these tests is incredibly positive. And I think if the states work with the Commonwealth, because we've seen the Victoria's come out today and also put a substantive order in for those tests, as we move through this next phase, the coordination with the Commonwealth Government will be key in ensuring that those tests are available to those who need it, and for those who are more vulnerable in our community, those who are elderly, have access to those in an affordable way.
You've repeatedly...
Those who need the test, so low-income workers, $20 a top is a lot.
Yeah.
So would free rapid tests for them be an option?
Yeah, I mean, that's the key point. That's the key point, because we want to make sure that these tests are available to those who need them. There are many people who will be able to afford those tests as more come onto the private market, but ultimately for those people who have less financial means, who are more vulnerable, that the state is there to support that. And I think that's what I'm saying, that coordination between state and federal governments, if we can have a consistent approach, that will provide greater clarity for our people in whatever jurisdiction you live in around the country, but ultimately want to make sure that everybody, whatever your financial means are, whatever the disadvantage you may have, that you're able to access those tests. This is something we'll work through at National Cabinet tomorrow.
Premier, you've repeatedly said that daily case numbers are going to rise. Modelling referred to by the Health Minister in previous days says that we could see 20,000 cases a day by January. Given that, shouldn't you have foreseen these demands on the testing system and better prepared for this?
Well, these are new issues that have arisen, and one of the areas that's going to be of key focus for us, and that's why the key message we are making today refers to PCR testing. We're transitioning from a phase where the government over the last 2 years has told everybody, and rightly so, to go and get tested. But it's become ingrained. We now have to shift across to say, if I'm not unwell, I won't go and get a PCR test. And I can't say that too often. I'll say it every single press conference, as will the Health Minister, because we really need to ensure that if you are standing in a queue for a PCR test and you are not unwell and are not required to by New South Wales Health, you should not be lining up for a test. We are seeing that right across our state. It is putting pressure on the system. We put as much into it as possible. And as we transition to rapid antigen tests, that's the new order in 2022. Now, from the order that we put in more recently in relation to those 20 million rapid antigen tests, our expectation is that they will arrive in mid-January. And we will work on the distribution of those tests with the Commonwealth Government. Ultimately, it makes sense to do so through pharmacists, GPs, and potentially our vaccination hubs. But we'll work through that to ensure that those people, particularly those who are vulnerable, who are at disadvantage, are able to access those tests.
When we're talking about these rapid antigen tests, how can we be sure that people are being honest about whether they're positive or negative, and how will we know that they're going through a PCR test like Chant?
Well, this is just the movement into the era of personal responsibility as we move through the next phase of the pandemic. This is about people looking after their own healthcare. And we will obviously tomorrow at National Cabinet be discussing issues in relation to the isolation requirements, the close contact definitions. But what I believe that you will see over the next, the next month, this next period of time, is substantial change substantial change to how state governments and the national government look at the requirements in relation to COVID-19. And that is simply due to the fact that we're moving through the next phase now. And that takes adjustment, that takes change, and change can be difficult, particularly in circumstances where we've had a very similar approach for 2 years. And we've had to have taken that approach because our vaccination rates were not where they were meant to be. We didn't have a vaccination for 18 months of this pandemic. People have now come out, taken that vaccination, and now we're in the phase of opening up. There'll be different issues. When you say things that come our way now, I'm sure there are things that we have not envisaged today that will come our way next year over the course of the next 12 months. What we have to be as a government is agile, adapt the circumstance, adapt the messaging to the changes that we're seeing. And I'm very confident where New South Wales sits today, based on our vaccination rate, based on the efforts that everyone's made, that we're going to lead the nation out of the pandemic. It's been a tough 2 years. It's a final push right now. We are standing strong as a state and we're going to get through it.
I mean, it wasn't a personal responsibility to envision the strains on testing capacity when you started to open up the state. Shouldn't you have taken steps earlier to increase that capacity or make that order for that test?
Well, in relation to PCR testing, we are at capacity. And prior to Christmas, we had a number of discussions with private pathology companies in relation to making sure we kept that capacity going. And obviously there were concerns there in terms of we had frontline health staff, many of these testers on the front line for a substantial period of time. There is a lot of fatigue, and I want to thank them for all the work they keep doing. They have stayed open. We are at capacity. We are doing everything we can to get through those tests as quickly as possible. The best thing that we can do is have that clear message that if you are not unwell, you do not need a test. And that is what is putting pressure on the system. The number of people queuing up, and I understand why, completely understand why, because that's what we've been saying for the last 2 years. But this is a new time, and if you don't have symptoms, if you are not unwell, you do not need a test.
Yes,
Just on close contacts, the changing of that definition,
Yep.
how does that benefit the health system and also business?
Well, I might have Dr. Chant speak to the health system impacts of that.
So I suppose what it reflects, and we may even change the way we use words like close contacts, because we have trained the community so much with those terms close and casual. We probably need to just explain it using different language. At the moment, from a public health perspective, we know the people that are most at risk in general are people that live in the household. Now, there's obviously some exceptions to the rule there, but in general, your household contacts, the people you live with, are going to be very likely to acquire particularly Omicron, because we know that the vaccine doesn't afford the same protection against acquiring the infection. We know that boosters help you with that and sort of take us part way to where we got with the vaccines against the Delta strain. So therefore, what we're doing is we text out to everyone who is a case and talk to them about what they need to do to isolate to protect themselves from transmitting. But we know most of those people have also already been infectious and interacting with people in the household. And the reason for that is reminding people that people are maximally infectious, most infectious, when you've got that 24 to 48 hours before you've even got symptoms. So you can imagine that you've already probably passed the virus on to the people in the household, and then those household people will come and get it. So that's the rationale for why we say it's wise for your household to get tested, because many of them the majority of them will turn up to be positive, particularly with the Omicron. So that's our focus in public health, and then we're asking people to tell us if they've been to an aged care facility, a correctional facility, a disability group home, an Aboriginal community, because we're wanting to make sure that we contact that aged care facility and see what we can do to what measures we need to put in place, or what additional work we need to do from a public health perspective. So we, with these numbers and in this transition of living with COVID, are going to have to prioritise our action to those areas that are the most yield. And every time over this journey, we will have to reassess, is that the right group to be focusing on? But what we're also asking the community to do is to let their social networks know that they've been positive. And the community is so good at that, probably so amazingly good at sharing. That in itself has caused a ripple where people have just got a message, I was positive, and they've all gone out and got tested. Now, what we probably need to do is work with the community to let them know a little bit more about how COVID's transmitted, how to make that assessment themselves, and perhaps move to a situation where we allow the community to determine whether they've really had contact with that person, or whether they that would be a high risk, or whether they can just monitor for symptoms. We also know that contacts of contacts, because social networks are so quick. In the past, we've had that testing of contacts, but no longer that's not a relevant concept for the current days. So we are going to have to educate the community about how to make those risk assessments themselves, because we will not be interviewing cases in that way that we've done in before and found, who's your social contacts and making that assessment for you. It's going to be more about a general information and empowering the community to make those decisions. And that's going to be a bit of a partnership, and we'll get it right and wrong and have to work on that communication style, but that's the aim in the future.
That's how the cases today, 625 at hospital. Just how prepared is the hospital system? How many beds have we got? Can you remind us of that? I know it's 1,500 ICU back in Delta. Is there still that many ICU now? Have expanded that? And how many hospital beds though? 625 today. Hospital.
Look, I just have to take that on notice, and as you know, our hospitals at the moment have a system where we can, cancel elective surgery, do other things to free up bed capacity. So we have that, and we also have that ability to work in a network system. And I think we demonstrated to the community, whilst it was very challenging for our frontline healthcare staff, how we managed to do that through Delta. But personally, I don't want to see it to get to that system. So I would actually like to say that the community can take those practical steps. I would personally want to see our case numbers held as low as we can, and that's in everyone's interest, to slow the spread through the community of Omicron. And in the first wave, we may have about 10 or 15% of the community acquire it, and then the history will be COVID will be with us for years and years to come. And we are going to have to get used to that, and hopefully it doesn't throw up any more variants that are more transmissible and more severe, the wrong combination. But we are conscious that even though it might have a lower severity, just the sheer numbers are going to be the challenge for us. So we are watching those ICU numbers and our hospitalisation numbers. But what individuals can do is not go out and about when you've got symptoms. Get tested instead. Be cautious around, those big events. If someone says, how about we go and book a venue, say, is it a well-ventilated venue? When you're there, ask people to keep the windows open. Simple things like that can really reduce the risk. So I think it's important that the community knows that they can take active steps to keep themselves and their loved ones safe. And we, notwithstanding the rain, the weather has been absolutely beautiful, and so we're actually approaching this in a summer time, and we've got to use those natural assets to maintain some normalcy, and choose our entertainment and really take it outdoors in that much lower risk setting. But do not go out and about. Get tested. I really do want to see those numbers as much as we can, low as we can, despite the increased transmissibility of Omicron.
For hospitalisation.
Oh, look, I think we need to keep readjusting and reflecting on our approach all the time. Clearly that was uploaded advice on the CDC website, I think it was yesterday. That's been incorporated into some documents that are being considered by AHPCC, Australian Health Protection Principal Committee, ahead of the National Cabinet. And I think we need to keep an open mind, look at the science. But increasingly we just need to work with the community to support them with their understanding, and for us to have almost a shared risk in that understanding, because people may make different risk decisions. I think the example earlier on was about the immunocompromised person. So depending on what level of immunocompromise, you may make different decisions. You may choose to even to wear a mask in an outdoor setting. You may choose to make sure you keep a very tight social network, and you actually might ask all of your social contacts to actually have a rat test before they're with you. These are the sorts of tailored advice that people will have to make, tailored decisions people will have to make as we go ahead. But we have to be open with the exposure risks that people have.
South African experts saying that they expect that Omicron might actually fade away by the end of January. Are we hearing similar things here?
I think the curve has gone down, so I think what we know from South Africa is that it's been quite a massive uptick and then a drop down. Look, there is some science behind that, because when you get a certain proportion of the population exposed, you actually boost their immunity, and then it almost acts as if you're boosted with vaccine through that natural protection. At some points in time, the positivity rate in South Africa in some of the tests were 30% positivity. So you can see that there was a massive spread in the South African population. It's always difficult to draw direct comparisons. Remember, they'd had a large previous Delta wave, much higher than our Delta wave. They have had previous waves, and so it's always, we have to apply caution in drawing those direct comparisons, but it's because it's so transmissible. But I actually want to slow the spread.
Just when it came out, the tolls go up on Saturday. A lot of drivers are feeling gutted by the government over this. What can we do for them? What will you do about it? Can you do anything?
We want to make it as easy as possible to put downward pressure on family budgets right across the state. And being in government as former treasurer, there are many, many cost of living measures that we have put in place, whether it's active kids, creative kids, toll rebates. We want to do everything that we can, but ultimately we need to build the roads of the future. When we do build toll roads, we ensure that there are other roads that are alongside those roads. And that ensures, take WestConnex for example, that Parramatta Road flows faster. And ultimately we didn't take this path. And I know the Labor approach is to build nothing and do nothing. And the result of that is congestion right across the board. It was the Labor Party that opposed the construction of WestConnex. They opposed the construction of the M2. They called the M2 the road to nowhere. They said no one lives in northwest Sydney and no one will ever live in northwest Sydney. Well, could you imagine life in northwest Sydney if every single motorist was driving up Epping Road every single day to get to work? That is not a viable option. Now, we want to do whatever we can to put downward pressure on family budgets, and we are. There are a number of vouchers across the board through Service New South Wales, free car registration, active kids, creative kids. There's a whole range of measures the New South Wales government has put together to put downward pressure on family budgets. Where we can do more, we will. We know tolls are a challenge, and that's why we ensure that when we do build those roads, there are alternatives available to ensure that there are free options for people who don't want to pay. Thanks.